Clinical indication: patient presented with right lower quadrant, abdominal pain, and localized tenderness. Ultrasound examination was performed using graded compression technique to assess the appendix and surrounding structures. On-focus sonographic evaluation of the right iliac fossa. A blind-ended tubular structure was visualized arising from the cecal pole. It measures approximately 6 millimeters in outer diameter, with preserved wall layering. The lumen shows minimal echogenic contents without significant distension. The appendiceal wall appears mildly thickened but remains compressible, only partially on graded pressure. No appendicolith is visualized within the lumen. Surrounding periappendiceal fat appears slightly echogenic, suggesting mild inflammatory reaction. There is no evidence of periappendiceal or pelvic free fluid, and no loculated collection is seen. Adjacent small bowel loops appear unremarkable, and no significant mesenteric lymphadenopathy is identified. The urinary bladder is normal in outline, and the right ovary in females appears within normal limits. Sonographic findings reveal a blind-ended loop measuring about 6 millimeters, arising from the cecum, with settle wall thickening and periappendiceal fat changes. No free fluid or abscess is detected. These findings are suggestive of early, uncomplicated, acute appendicitis in the appropriate clinical context. Recommendation: correlate with clinical signs tenderness, leukocytosis. If symptoms persist or worsen, surgical consultation is advised. CT abdomen with contrast may be considered for further characterization if diagnostic uncertainty remains.